Welcome to Cypherpunk Bitstream, episode 0x07, Pandemic Part 1. And today I have a very special guest with me, my dear friend Artur Bendekin from Ukraine, who was one of the co-founders of Task Zero before he moved to Ukraine. Welcome, Artur.
Hello, Frank. Nice to be here.
Nice to have you here. Usually we're always recording in the container, but since we're both now somewhat in lockdown and we have a special situation, we have the first remote episode and also the first one without Smuggler. I hope we're gonna have another one in the future, all the three of us. But today it's just the two of us talking about the current coronavirus pandemic. And since you were one of the first persons who actually got me on the topic and was concerned about it, I thought it's a good opportunity to talk with you. So what do you think? How did we actually get here? What set this whole thing in motion?
Well, I think the place to start is, as you said, you are in lockdown and I'm in lockdown. So what does that mean? And why are we in lockdown? And should somebody else be in lockdown, perhaps? So for my part, I followed the developing situation in Wuhan since the beginning of January, and by the end of January, certainly the last days of January, it became clear that this wasn't going to be something, one of those things that you hear about in the news, far away, and it's very tragic, of course. But it doesn't affect you, like starving children in Africa. But instead, this was something that was going to come home to roost to all of us. And so at the end of January, I began preparations, taking some actionables. And it's been a pretty crazy, what is it now? It's, let's say 6 weeks since
6
then.
weeks, yeah.
Yeah, I think for you too. You pretty much started at the same time, I think.
Yeah, I think I was a little bit more optimistic than you were, although I think I decided around the same time that I gonna buy some insurance, so to say, by preparing for the worst. And I hope that they're gonna be able to contain it, but these hopes didn't really work out. So
yeah, hope for the best, prepare for the worst.
Yeah.
Yeah, I think we see eye to eye on that. And so the situation is that I'm ready with my preparations, and I believe you are with yours. And let's see, when did we go into lockdown? It's about a week ago. We already started social distancing, as it's now known, a few weeks back. Not meeting people, and about a week ago, decided that we just don't meet anybody anymore.
Yeah, basically, stopped meeting anyone a few days ago and try to move everything online. Also finished preparing, and it's been a crazy month, man. I never expected that prepping is that much work. I thought it's just, you order a few things, you buy a few cans, and you're done. But it turned out to be like a major effort.
Yeah, I would say that it certainly consumed, let's say, half-time effort for all of these weeks. And now, of course, the size of the task is going to depend on how many people you're prepping for. In my case, it's about 11 people in total. So
wow, that's a lot.
Yeah, that's a sizable task. And I didn't expect it would be so much work, but it sort of takes a life of its own.
Mm-hmm.
And now I'm glad, of course, because, for example, my wife, my dear wife, she was privately skeptical. She confessed a few weeks ago. She was privately skeptical for, I suppose, most of February at least. But in the last 2 weeks, it's become clear to her as well that we made the right call, and she's very happy about that.
Well, maybe let's walk our listener through the original risk assessment? I mean, what made you think that it's going to be a big deal, or it might become a big deal that you should prepare for it?
Well, I didn't set out to go into lockdown a few months later, but following the situation in Wuhan, it became clear that we were dealing with something which we haven't seen in a while. We were dealing with something that wasn't anything like the minor outbreaks and scares that we had in the last few decades. And I suppose I was psychologically oriented towards accepting that because of a lot of reading of history in the past, including, of course, about the events in 1918, the terrible so-called Spanish influenza of 1918 to 1920, which killed up to 100 million people. And so Wuhan was showing us something like that, mostly through the videos that were coming out from there. I mean, the official data, the official statements from the Chinese Communist Party, they were very reassuring. But when a communist tells you something like that, then you should look deeper. And the videos that were leaking out of Wuhan were really quite impressive.
Yeah, there was surprisingly a lot of material leaking, and I also had the impression that it was pretty significant.
Yeah.
What really got me was the high infectiousness and the fact that it seems to be, or at this point it's established, but at this point I think it was more speculation, that you can be infectious without showing any symptoms.
Right, although as that turns out, it's not so uncommon in the flu as well. But yeah, the virality was pretty impressive, and then I think the videos that made me really pay attention in the very beginning were the cases where you had people dropping suddenly in the street, and that was very reminiscent of what happened in 1918 as well.
You read that book before the crisis already, or before Wuhan?
If you're talking about the Great Influenza,
yes.
Yeah, John Barry's book. It's a great book. I recommend it. And yeah, I read that about 20 years ago.
Oh, okay.
For the first time, and I started rereading it just end of January because I wanted to understand what was going on. So there were numerous, probably hundreds of videos of people just dropping down suddenly in the street. Some memorable ones, for example, the woman in the vegetable market dropped down on the vegetables, flashing her panties. Pretty strange. This kind of strange scenes that were not being covered at all by the media, and I felt it was important to understand what was going on with that. So I started digging and paying attention, and then by the end of January, I figured pretty much that it was a matter of time before it would go global. And I gotta say, Frank, it's one of those things I never wanted to be so wrong about anything. That would have been great to be wrong. I had plans for this year. You had plans for this year.
Yeah, my plans were a little bit different than what they are now, or what they seem to be now.
Yeah, to say the least. And so by the first week of February, I already counted all of my travel plans for the year as lost. And indeed, that's very likely the case. And yeah, just began executing on a lot of orders to prepare for what's now upon us. So I view the situation a little bit like this was, I think, a metaphor from our mutual friend Steve, that an earthquake happened in Wuhan and the tsunami will follow. It's hard to see the tsunami until it comes close to the shore. But reason tells us that it will follow, at least in most cases. And it would be prudent at some point to seek higher ground. And that's also something I think we can talk about, that how it seems to me is that for most people right now, even still now, at least over here where I find myself, people are still playing on the beach. They haven't put away their toys and headed home. But we already see the wave rising from the sea, and it's an impressive wave. And I think this was a very analytic preparation for me. I have to say that emotionally, I suppose, only in the last few days, as I began to really see the magnitude of the wave, that I felt any kind of fear per se. And that's also another thing to talk about. You and me, we prepared early, and almost everybody we know is still unprepared. And many of them will have reason to regret it, unfortunately, very, very soon. And, you got the same responses as I did, that we were accused of panicking. But I suspect it will be those who didn't prepare at all who will actually have to panic soon.
Well, I think myself personally, I didn't experience it that much because I didn't try that hard to convince people of preparing, because I kind of suspected that there will be not a favorable reaction. But my girlfriend certainly tried to do that, and she got ridiculed basically. So I find this whole this human aspect really interesting, how people react to something like that. And I certainly I felt a bit crazy myself sometimes, in the early stages of preparing for this. That I thought, okay, maybe I'm totally wrong, maybe I'm totally crazy, but I figured, okay, I have to look at it as an insurance, and we basically made a risk assessment of, okay, this might happen, this might go global, this might be a global pandemic, and we might have to face lockdowns. We certainly should go into lockdown if that happens. So how am I going to prepare for this, and just look at it as a form of insurance for the probability that it might happen. It's like you get in. I think that's one psychological aspect. I'm surprised that people, they buy all kinds of insurances for events that are very unlikely to happen. But when you tell them to buy, let's say, 30 kilos of rice, then they think that's completely crazy.
Yeah, it's very interesting. And
although it's something very tangible, something you do not even have to ask somebody then later. I mean, insurance, you still have to file a claim and try to get the money. But this is very tangible insurance.
Yeah, there's a couple of interesting observations on this. I think Taleb had a good tweet the other week. He also wrote a nice paper already, I think back in January, on this one page that everybody should read. But he had a tweet on paranoia. I consider it a sort of expansion of or a corollary to Andy Grove's famous "Only the Paranoid Survive." Taleb said that if when you're paranoid, you can be wrong 1,000 times and you can survive. Now, of course, that could be qualified. Depends on the cause of being paranoid. But when non-paranoid, if you are wrong once, your whole lineage is done, your whole family is done, your genes are ended. And that's why we got this, let's say, this sense to pay attention to something like this, something so remote as it seemed in January, so abstract. But not everybody seems to be able to take actionables based on something so far away. And on that count, there was another Another nice observation from somebody I follow, Balaji Srinivasan on Twitter, probably mangled his name a little bit. He observed that there are three kinds of people. There are post-headline people who only believe things that are already in print, headlines of newspapers. There are no-filter people. They'll believe anything. Conspiracy theorists, and Lord knows there's plenty of conspiracy theories around this novel coronavirus.
And good ones. Huh?
Yes, indeed. And then there's the pre-headline people who will listen to a rational argument and who will look at the primary data and come to their own conclusions. And this I think was a very, very good observation, because in the last weeks we have really seen this in action. It's about how people form knowledge about the world. I've always thought of it that most people they form their knowledge assessments based on what other people believe. And I think we talked about this in the past sometimes, you and I. And authority, of course, is very important. But who is an authority? An authority is somebody that many people consider an authority. So it's nicely self-referential.
Yeah, it's this combination, right? You either have some form of credentials, like either degrees or position that give you this appearance of authority, and then also that other people consider you an authority, and it often goes together.
Well, right. I mean, credentials are only worth anything because people believe in them.
Sure.
So, for example, a degree from MIT might be more valued than from some third world university. And the pre-headline post-headline divide has become extremely clear now in the last weeks. Like you said, I think you in this case, I was more optimistic than you were, in that I actually tried to talk to family, to extended family, some friends about the situation back when there was still time to prepare, back when the wave wasn't even visible. So, talking 2-3 weeks ago, before Italy, and in the beginning of what's going on in Italy. And the responses that I got, they made me really appreciate in a new way, the Cassandra myth from the Iliad. Cassandra was the daughter of King Priam, and she was blessed and cursed by the gods. She was blessed to see the future, and she was cursed that nobody would ever believe her. And this has been a very interesting dynamic to experience myself. That it's really been a very uniform set of responses, such as you're panicking and making it worse, to a perfectly rational suggestion that here's how the situation looks, and it might be prudent to stock up on some things while stocking up is still easy. And in other cases, the dismissal out of hand of something like this can't possibly happen. It's just some science fiction movie.
Yeah, I find this whole thing with Bill Gates particularly funny. That he does a lot of work in that area, and he warned about the danger of pandemics already years ago, and I think he considered it one of the major threats that humanity has. And there was a lot of dismissal of his arguments by things like saying, okay, he's a college dropout, or what does he know as an IT guy about pandemics? And which shows, I think, exactly this authority bias. And also a little bit maybe even confirmation bias or like ad hominem attacks in that case. So saying, okay, he doesn't have the credentials, so we don't even have to listen to the arguments. And
Yeah, that's right.
Yeah. You
Yeah, what
probably
did Bill Gates
experienced
say?
that as well. Huh?
Yeah, certainly, of course. What did Bill Gates say? It was that this was the most predictable catastrophe in the history of the human race. And of course, it doesn't mean specifically this virus. It just means that, like Albert Camus said, these things do have a way of reoccurring out of what was it, a blue sky, clear sky.
Yeah, he gave a good talk. I think a TED talk. I don't know, 2016 or 17, something around that time, warning about this. And I think it's not like you said. They have a tendency to occur. There are also certain risk factors which actually increased, like big cities, a lot more international travel. So it's not just like that we have that base risk. The risk is actually, it got higher in recent years, I would say.
Right. It was something like this, on average 3 pandemics a century for the last few centuries, but something like 7 since 1990. Although, of course, until this one, they were minor and contained.
Yeah, I mean, the containment worked pretty well usually, but that also was a very close call sometimes. I mean, this Ebola pandemic, for example, or the Ebola outbreak, it wasn't a pandemic, could have been gone really wrong. They were lucky that it didn't reach the the big cities, so in Africa at least.
Yeah, and there's also I suspect many people don't know actually why we haven't had such bad times recently. So recently, as in let's say the last 50 years, it's about 50 years since the Hong Kong flu, which killed 1 million people in the late 1960s. And this is something that in recent reading I've come to appreciate all over again. So, we sometimes during our lives, we've seen headlines about, millions of cows needed to be slaughtered to contain mad cow disease, for example.
Mm.
But it turns out, of course, that it's pretty common. There's millions and millions of chickens and pigs and whatnot that have been slaughtered in the last decades at the slightest sign of something, they might be able to jump from them to humans.
Mm.
And it's come at an enormous economical cost. It's a little bit like the situation with vaccines. And I know, there's no doubt listeners who won't like what I say on that, but it's a little bit like with vaccines that if we lived in the world of 2 centuries ago, I doubt we would have too many anti-vaxxers. But the success of vaccines and public health in general means that we have now the luxury of opposing vaccines, because many of us have no concept of how the world looked back before we were able to fix a lot of these terrible endemic diseases.
Yeah, I mean, smallpox was certainly pretty bad.
Yeah, it's actually reading about smallpox would be most educational and informative to anyone who has questions about those things. And it's a little bit of a similar situation that if people only knew the lengths to which people have gone in order to stop this, for example, in particular influenza, from jumping into humans and riding hard, as in 1918. So it's really not that much of a given that we've had this long break from something like what is happening this year.
Yeah, I think we are already. Sorry, we're still in the beginning of of the economic impact of this pandemic, but we can already see that it's the price you have to pay when you slaughter, like, let's say, a few million of pigs is relatively small compared to when it breaks out. Just looking at it economically, not even factoring in human costs, but
yeah, and of course, like you say, it's insurance. I think there will be more appreciation for such efforts after we are done with this pandemic.
Yeah. What I found really interesting was that I think you pointed me towards the Spanish flu, and I started reading up on it, and then the updated numbers show between, let's say, 50 and 100 million. Some estimates are that it's more than World War I and World War II combined. And I was really surprised how little it's being talked about, for example, in school and other places. And my theory was that there's really this bias of humans that we want to focus on things that are caused by humans. So like a world war is a human thing, so we always talk about it. But these pandemics, they've been looked at as something that just happens. And I think that also drives a lot of the response to it, that people seem to have this attitude towards it that they cannot do anything against it. And, it's just
helplessness.
Yeah. There's nothing we can do. So let's go on and enjoy the day, that sort of thing. I found that really interesting.
Yeah, I suppose that could be called agency bias, what you were talking about. That I think we see that with all the conspiracy theories on where this thing came from.
You mean the ones that basically always say, okay, it's been man-made and it comes from a lab, or?
Yeah, sure. So, there's any number of notions that it came from the weapons lab let's not call it weapons lab, that's already granting something, the biolab in Wuhan. And maybe it did, maybe it didn't, but we are certainly, as a species, biased towards the explanation that it was created by something or someone with agency.
Yeah,
it seems to be. Yeah.
Even if it came from the biolab in Wuhan, that might have been just a fuck up and not like intentional.
Yeah, I think it was you who pointed me at some point at the idea. I'm not sure that it's confirmed, but the idea that sometimes researchers sell the animals they experiment upon for a little private pocket cash instead of exterminating them as they're supposed to. So, I don't know if that's true, but that would be an example of something that then might be non-intentional, even if it did come from something with agency.
Yeah.
But I've wholly ignored from the beginning where it came from. I think that's just a sideshow. And
yeah,
I don't
it's not
have
important at this point. I think I agree. I mean, it will be very interesting later on for historians to dig through this, but at this point, for the proper response, I think it doesn't really matter.
Yeah, there's nothing actionable for us in where did it come from, and also there's really no particular reason to suppose that it's anything but natural, even despite all the coincidences around where it might have originated. It's just this agency bias at work that we find it so difficult to believe that the universe sometimes does a little cleaning of the room, and we might be in the way, and we always want there to be some motivation or reason, some mover who made it happen. So that's certainly one more bias we could discuss here. And actually, I think a lot of this conversation will be about these biases. So maybe it makes sense to define cognitive bias for those who may not be too familiar. So a cognitive bias is a systematic error of thinking. And we have a lot of cognitive biases, which is not that surprising because even despite everybody who believes that man is the rational animal, at best we are the rationalizing animal. And we are animals. That's the part of the sentence to underline. So we have this evolved, adaptive, how would you say, subroutines that are on the lookout for example, faces in our vision processing. We see faces in clouds where there are none. It's an example of a cognitive bias. And we have a lot of these areas where thinking goes wrong, because unless we very carefully step through every step of the process, we fool ourselves. And as Feynman said, we are the easiest ones to fool. You yourself are the easiest one to fool. So,
yeah, I think that was a good definition. So maybe we should talk about the concrete biases a little bit more now. You already mentioned
which ones have you observed in the last 2 months, especially?
Well, I think certainly the authority bias, which we already covered. Then also the confirmation bias, basically people looking for information that confirms their already held belief.
Right.
And funnily also in combination. So basically people looking for the one medical doctor that actually says this is just the flu. It's not a problem. And then using that as an argument. What else?
Well, I would say normalcy bias.
Yeah, can you define that?
Yeah, nobody wants to be bothered to change anything about their life. It's a big upset to have to stock up on toilet paper, for example. And so you could think of it like, this is annoying and upsetting me, and I don't want to deal with it, so you must be wrong. And on that count, there was a very interesting quote that I came across recently. I'm sure everybody knows World War Z, this zombie franchise of some note a decade ago. The creator of that, Max Brooks, he gave an interview in 2011, I think it was, where he actually made clear something that wasn't clear to me, certainly, in the last decade, that it's not really about zombies. The World War Z is about the pandemic. It's just that this fear of epidemics is so deep in us that you couldn't actually discuss it rationally with people. You would just get these dismissals, these out-of-hand dismissals, like Bill Gates was getting, and anybody who did try to talk about them before one is upon us. And so if you instead talked about zombies, you could deal with many of the same themes, in terms of preparation, social distancing, community, survival, all of this. But you could deal with it in such a way that people wouldn't have this automatic reaction that this is not something that they should pay attention to. So that was very interesting, and I suppose that could be an example also of agency bias. That a zombie is easier, a threat that's easier to deal with than a virus. You can't see a virus; it's a fully abstract threat.
Yeah, I agree.
When the virus infects you, there'll be eventually up to 1 trillion copies of it. But in any case, you can't see it. It's just something microscopic, and you can only understand it with reason. And the zombie is very visceral.
It must have been even more horrific back in the days, like when they had the plague, for example, when people didn't even know what caused it.
Right. Yeah.
I mean, at this point, we know a lot about viruses, and first of all, we know what a virus is, and we know a lot about how it actually functions, and even how we can treat some of these diseases. But this unknown danger must have been much worse. But still, I mean, I think that was a really good point, that zombies are probably evolved as a metaphor to de-risk pandemics. Makes it much more believable.
Well, I wouldn't go so far. I'm not sure that the whole zombie phenomenon is about that, but certainly Max Brooks claims that World War Z specifically was about that.
Okay.
So I would be interested to find more on that whole question, but that's a low priority in the current research curriculum.
Yeah. But practically speaking, it seems to be easier to convince people to prepare for the zombie apocalypse than to convince them preparing for a pandemic of coronavirus or the flu.
Yeah. I would ask the question though. So if Max Brooks intended it in this way, I would ask the question: is it an effective way to reframe the threat? As in, you and I'm sure we both know zombie enthusiasts, fans of The Walking Dead and so on. And did it make any difference in how well prepared they were for this pandemic, or how quickly they prepared, or something like this? As in, is there any kind of efficacy to this idea that you could dress it up in zombies? And I certainly don't know of any evidence so far for that.
No, unfortunately, I don't know of any evidence either. It seems to be more some form of entertainment.
Yeah.
So
now, in terms of the authority bias, one thing I might mention is that the other reaction I've seen is that given that people assess experts by seeing who other people think are experts, and given that the default response of a lot of people in dealing with something like this is not to try to understand what's going on fundamentally, which I think is the response you and I have, try to understand what's going on ourselves, but rather to try to find some experts to attach to, so to say. That I think of it as selecting your expert portfolio. So, like you mentioned, in case somebody is not overly concerned with the situation and he just wants to be reassured, then latch on to an expert who tells you it'll be fine. And I saw a lot of this in the last month. But it's a very interesting kind of, how would you say, indirection, because if you assess which experts to listen to and then basically take their word as gospel, you're still having to engage your own brain. It's just that you're engaging your own brain about, let's say, social status instead of the primary data. So you're still having to use, judgment on which experts to listen to and which not. And I would note it's much more susceptible to these cognitive biases, such as confirmation bias, which you mentioned.
But that might be something that is built into us,
Of course, I don't doubt. But it's just dismaying to see that, people start from the premise that they are not smart enough to understand what's actually going on, which may or may not be true. But in any case, they don't make any effort to understand what's going on. They just look for some expert to tell them what's going on and what should they do or what shouldn't they do and so on. But so I'm just trying to point out that they move this process of judgment out from the realm of primary data and facts, judging of facts or judging of claims to be facts. They move it into the social realm. That this and this expert is respected because of this and this, and he's got this degree and he's got this status earned, no doubt, and all these other people consider him an expert. So it just goes into kind of soap opera land instead of trying to understand what's fundamentally going on. And so this also was a very interesting contrast in people. If you talk about pre-headline, post-headline, and also this, that, do you try to understand the data as they are coming in? So, for example, I did, and I'm sure you did in the beginning, reading the papers that were coming out of Wuhan, out of China.
Yeah.
Now, of course, it's such a deluge of papers you can't possibly keep up. It's hundreds and hundreds of papers, and of course also a lot of them preprints. So of increasingly dubious value, as we've seen with the many retracted preprints.
Yeah, I mean, there's certainly also some form of psyops going on. People using that mechanism to push their agenda.
Yeah, some strange things in those preprints, certainly, about HIV genes jumping into this and blah blah.
Yeah, very convincing, some of them.
Yeah, some of them quickly retracted, and some of them not before they had impact on the popular consciousness about this disease. So now it's impossible to keep up with those unless you actually are a researcher and you try to figure out what's going on, what everybody doing. But certainly for us, not anymore feasible to keep up. And by the way, that means also that something I recognized myself in myself lately is that I'm getting to be a little bit out of date on the current findings. In the first 2 months, it was possible to understand all the new claims about what's going on, and now it's beginning to be impossible to keep up. So
yeah, I think that's also related to the fact that it's now basically going global, and so you have a lot more data.
Yeah. But it's also related to, it's a lot easier to filter the signal from the noise in the beginning. Even if you just think about the case counts. So what are we at today? I think it was 170,000 infections, confirmed cases. We don't know how many infections there are. That's important also. But 170,000 confirmed cases and something like 5,000-6,000 deaths. I think those were the figures as I saw them last. And it's already a massive increase just in the last week. It's probably about 1 week ago that we had 100,000 cases. So it's growing very quickly, and it's impossible even to keep up with the news of new confirmed cases. At this point, it's becoming just noise to be ignored. Whereas in the earlier weeks, there was some sense still in trying to understand where are the cases, how often are they detected, what kind of clinical presentation, and so on. Now it's just game over for that. It's everywhere, and it's good that these confirmations are coming from everywhere. But it's also that's another topic of bias, that people tend to focus on surface phenomena. So, for example, they think about the confirmed case count as though that was something God-given. But actually, there's a lot of limitations on something like confirming a case. There's manpower, resource questions. For example, in the beginning, when the cases in Wuhan were growing, Wuhan had a testing capacity of about 3,000 test kits per day. And so there was no way that the case count was going to increase by more than 3,000 a day. But that is something that people forgot when they looked at it. Oh, it's not actually exponential. It's just increasing by 3,000 a day, and it's fine.
Yeah, now we have the same problem again in the US. As far as I know, they don't manufacture enough test kits, and Berlin is also very hard to get tested. So even people who have symptoms and want to check if they have infected by this virus, or if they just have a normal flu, they can't necessarily get tested. So we have the same phenomenon again.
Yeah, and also also over here in Ukraine, it was less than 2 weeks ago, I think, that the first case was confirmed in Ukraine. And it really should have been obvious to everybody paying attention that, of course, Ukraine has infections. Confirmed cases are a lagging indicator. And especially in a country that doesn't have a, shall we say, advanced medical system, and that has a history of, how would you say, governments giving you some other version of reality that might have happened. It should be obvious that it's not the indicator to pay attention to. So, for example, right now Ukraine is at, I believe it was 3 confirmed cases, 1 confirmed death. But at the same time, I know from contacts in the hospitals in Lviv that there are many more cases and at least 1 more death already in the city as well. So when people focus on this kind of official measures and surface level phenomena that are limited by staffing, by test kits, by political considerations, then that's not a good way of getting at the what's actually happening. It's not a good way of understanding what's going on. And that's, to go full circle, that's why it was so good in the beginning to get this leaked information, leaked videos from Wuhan. That we got a sense of what was actually going on. Now, of course, it's very difficult to authenticate a lot of these videos, and no doubt we might have some in the collection of the ones that we viewed that wouldn't be wholly authentic. But as one might put it, the plural of anecdote is data. It was overwhelming data. Plus, we had this investigative reporting, for example, from the mortuaries in Wuhan, on how many bodies they were burning per day. These kind of figures.
Well, what I also found very convincing was just the fact what we could see what they did in terms of measures against the outbreak. I mean, even if you assume that the numbers are not correct and they might downplay them, the very strong response was a strong indicator how severe the situation is. Because otherwise they would never have such a strong response.
Yeah, it's true. We should remember that not that long ago, 800 million people were in lockdown of various kinds.
Yeah.
A tenth of the global population.
Exactly. It's not exactly a bias, but I wanted to talk a little bit about, let's say, mathematical modeling. A big term, but just simply that's something I observed a lot when talking to people, and also in counter arguments. Like what you hear a lot, that people are basically not able to grasp the exponential function. So I think that's a big problem. That people, they compare the death counts to the yearly flu count, which is a completely bogus argument. Because the coronavirus pandemic isn't over, so you cannot compare it to the flu last year and how many people that killed, and we're still in the early phases of an exponential function if shit goes bad. I think that's one big mistake, and the other one is this, let's say, the time lag. So first of all, you have people being infectious without showing symptoms. And that always means that when you, plus what you already said, the cases are not all tested, so you don't even know who's infected. But it also means that when you introduce some countermeasure today, you don't know the effect until like 2 weeks from now.
Mm-hmm.
And I find it kind of interesting how, for example, here in Berlin, in Germany in general, they kind of, introducing new measures every 2 days. although there's literally no data to back that up. So if you introduce a countermeasure 2 days ago, why would you introduce another one today? They usually do it because the numbers go up, and it probably makes sense to introduce those measures, but it's just it makes no logic sense,
Yeah, I know what you mean.
If you would do it logically, you would introduce full max Wuhan style measures today, and then you wait 2 weeks, and then you can measure the effect. Everything else.
It's like the governors in northern Italy begging to go into lockdown much earlier than they eventually were given permission to do that.
Yeah.
And well, in terms of also, I suppose a good topic to deal with here is the case fatality rate.
Mm-hmm.
So one of the things that convinced me in January to pay attention is that I was seeing the World Health Organization, who is in ostensible charge of the response to all this, although they of course have no actual power, just they make recommendations. All their funding comes from member countries, China among them. And I was seeing that they were driven by political considerations instead of, let's say, acting independently.
Mm-hmm.
And as I recall, there was something like this also in the response to the Ebola crisis earlier, that they did not render a very good response because of political considerations. And we saw the same thing in how long it took them to declare the public, what is called the international health emergency of international concern. PHIEC, something like this.
Yeah, because they got rid of the term pandemic, right, in their official.
Well, no, this was earlier. This was
Okay.
Preceding pandemic. It also took them a long while to declare the pandemic, of course. First characterizing it as a pandemic, and it could be called a pandemic, but we are not declaring a pandemic, and all of these things. But in any case, the more worrisome thing is that from the beginning they accepted the numbers that the Chinese Communist Party were providing them, and there's a lot of problems with those numbers, which we can go into if we have time. And the second thing is that they, in giving a case fatality rate, calculating a case fatality rate, they committed a really hard to understand mathematical error. I'm sure you know what I'm talking about by now. They quoted the so-called naive CFR as the what eventually became news headlines around the world. So it was about 2.1% for a stretch when it was mostly still China. Recently revised to 3.4% and going up. And this was very, very bizarre, because it doesn't make sense at all to calculate it the way that they calculated it.
Yeah, maybe you walk me through it, how they did it and how they should have done it.
Right. So let's say that you have a rapidly growing epidemic, as this one has been, and let's say that you have a 100,000 confirmed cases, and out of those 2,000 have unfortunately kicked the bucket. They've died from it. So in that case, the World Health Organization, they would quote you a case fatality rate of 2%.
I see. But since
since the 2,000 people who already died, they got infected much earlier, perhaps weeks ago, perhaps 3-4 weeks ago. That means that it's pretty nonsensical to compare how many deaths from infections 3-4 weeks ago to the current confirmed case count. It's comparing apples and oranges. It makes no sense whatsoever. And this is especially true given that in the SARS outbreak 15 plus years ago, the initial case fatality rate was also about 2%. But by the end of the outbreak, it was about 9.6 was the so-called resolved CFR. So it grew over time from 2% to 9.6. And the headlines were bizarre, a little bit similar to now, as in the fatality rate is growing. Does it mean that the virus is mutating? Is it becoming more lethal? What could be the explanation for this? And all the while, it's about using the wrong mathematical method to calculate a useful figure. So this was particularly bizarre. I mean, they continue to do it, so I don't know what the motivation for that is. But in any case, I would suggest that it's much more useful to look at the resolved CFR, which means that you compare, you only consider the cases that have been resolved, as in there's an outcome for a case. So, for example, right now in the 170,000 confirmed cases plus, a great many tens of thousands of those are unresolved. They will either be cured, they will recover, or they will die. And it makes no sense to compare past cases to current cases in the way that people are.
Yeah, maybe it was panic prevention again. I mean, it's the same mistake, basically, what I said earlier of comparing a flu outbreak 2 years ago to an ongoing coronavirus outbreak right now in total death numbers. It makes no sense.
Yeah. But this is particularly egregious because it's by the World Health Organization. And of course, it directly leads to headlines. As in, after they quote the CFR, the headlines the next day will be quoting that as the mortality figure, which of course is yet another figure that you can't derive directly from the case fatality rate, but never mind, that's lost in the public imagination.
Yeah, and I think it also leads to a lot of these naive probability calculations. So what was also published a lot were these case fatality rate numbers for different age groups. So, and then people are like, oh yeah, can't recall the exact numbers, but it's like, oh yeah, I'm just 20 and my probability of dying is less than 1%. So what do I care? And doesn't exactly really take into consideration that there's a significant percentage of cases becoming problematic, requiring hospitalization or even ICUs, and if the system is overloaded, this care cannot be provided.
Yeah, that's actually perhaps the most important thing to talk about. That so I think we both reached the same conclusion in late January, early February about that. That never mind what the case fatality rate might or might not be, we couldn't trust the figures from the Chinese Communist Party in any case. So we had to wait for this to spread outside to be able to have some more reliable data. And thankfully, that data doesn't seem as bad as it initially seemed. I mean, it's bad enough, make no mistake, but it could have been worse. But the really serious aspect in the early days that was already clear was that perhaps up to 20% of the confirmed cases required hospitalization, and some proportion of those, some good proportion of those, needed the intensive care unit, the ICU, in order to survive. And in any case, of course, many died in the intensive care as well. So that was really the thing that made me sit up and take attention. Now the figures in Italy exactly show this dynamic at play, that the hospitals in northern Italy are already overwhelmed since a week ago, and they might conceivably be in a catastrophic situation later this week, starting now. and that's going to play out in most of the countries we care about in the next weeks as well.
Yeah, absolutely. And that's the biggest danger, I think, that when these systems are overwhelmed, then the death rate inevitably has to go up because everybody.
Yes, we've seen. Yes, we see in Italy that the fatality rate is quite a bit higher than anything we ever got out of China in those figures.
Yeah, which kind of brings us to the topic of secondary and tertiary effects. I mean, that's a prime example of a secondary effect, right? You have a lot of cases and it overloads the medical system, and then the secondary effect is that the death rate goes up. And it also means that people who have other diseases might not be able to get the necessary medical care.
Yeah. This is also overlooked when people call this just the flu, bro. That the capacity of healthcare systems around the world, they don't tend to have a lot of slack because it's not economically efficient to keep 10 empty beds for every bed with a patient, every occupied bed. So there's not a huge amount of empty hospital beds just waiting for the next pandemic for no particular reason.
No, I mean, it's also economically impossible, I would argue.
Yeah, exactly.
Given what percentage of GDP usually the healthcare system already occupies, so it's already significant.
Yeah, so that means that as I remember figures from a few countries, it tends to be about 15-20% maximum that are unoccupied from those hospital beds. And that, of course, is saturated very, very quickly in a pandemic like this, in an epidemic like this. That in Italy they've already spilled out into the hallways for treating intensive care patients. And of course, from Wuhan we saw construction of makeshift hospitals and placing people into stadiums and other temporary arrangements.
Mm.
And we're probably likely to see a lot of that in Europe as well in the coming weeks.
Mm. Yeah. What are other secondary and tertiary effects you're worrying about or you're considering?
Well, if we were doing an investment podcast, right now the situation would be looking not so great. What are the biggest stock market implosions since 1987, and probably will turn out to be a lot bigger than that, just not all in one day. So we'll see how they put it in the history books. And of course, for closer to our concerns, I suppose, not only stock markets, but also the crypto markets imploding.
Yep.
And a general flight to cash. Now, that's not a direct concern to many of us, but of course the secondary effects from that, so the tertiary effects of all of this, will affect us also in some way. But I'm not the best one to talk or speak about what those effects might be. Now, the other things that were already clear at the end of January and more so in February, well, they concern the supply chain for most of the goods we consume, other than maybe food, although a large percentage of that also comes from China. So, I remember conversations with you, even you and Smuggler actually 3-4 years ago, when we discussed exactly what we are now seeing play out, as in we discussed that back in the day, if you had a crisis of any kind, you could rely on the supermarkets, the shelves going empty, but they would get quickly restocked from the back room.
Mm.
And I think that's the image that people still kind of have in their minds of how things work. But of course, that's not how they work anymore for a long time. Now we've had a just-in-time economy for quite some time. It's economically more efficient. It means that the back room is almost empty, and instead we get a truck delivery into the supermarket.
Yeah, I think
once a day, twice a day.
They usually don't even have a back room anymore.
Right.
So yeah, like you said, it's just in time delivery every day, every second day, and they have like this big storage area somewhere.
And that means that when supermarkets run out, well, that's really going to happen in one day, and the restocking will happen the next day usually. And then if they keep running out, eventually you're going to have a signal up the supply chain as well that might not be possible to meet. We see this now in the UK, where Tesco is limiting the amounts of purchases that one customer can do of toilet paper and other things of concern.
Mm-hmm.
And the second aspect, of course, being that the supply chains have all become rooted in China in the last decades. And this especially now is the first thing that ran out over here, and I think probably in Berlin as well, it was the respirators.
Yeah, it was the same in Germany as well.
Yeah. So by the way, pro tip for those listeners who might be confused by the terminology on respirators, it's a good time to be learning all these things. The kind you want to buy is known as FFP2. That's the European standard, and the equivalent, almost equivalent American standard is N95. You can also buy FFP3, which is equivalent to N99, but those are harder to breathe through, and you don't really need it. FFP2 should be fine. And those ran out a while back, and not only here and there, but everywhere. And it's quite likely we won't get any more in a while, because it was already, I think, beginning of February, China restricted all exports on those. And of course, since then, other countries have as well. But the problem is pretty much only China made them. All the production, like more than 90%, moved to China in the last 2 decades. So those if you haven't found them yet, you're not too likely to find them for a while.
Yeah, that risk was never part of the calculation, I think, in any of these supply chains.
Yeah,
it's just efficiency. It's never about the risk of failure.
Yeah.
And also, what I wanted to say earlier is, I think this whole pandemic response, it has a similar problem than IT security. Let's say you invest a lot of time and money into IT security, or you have a very good system administrator who does that, then you never have a problem. And then it might seem like wasted money and wasted effort. And I think that was a similar problem that the World Health Organization had. I think they've been accused for the swine flu that they overreacted.
Mm.
And maybe the overreaction was actually the reason, or the reaction was actually the reason that it didn't get that bad. And therefore it was later called an overreaction. And then now,
right, yeah.
Now they're more hesitant. It's a bit like prepping, It's really easy to be accused of being overreactive afterwards, but you usually want to overreact.
Yeah, exactly.
Right? I mean, no matter how bad it gets, you want to be overreacting in retrospect, because otherwise you didn't prep enough, and you're not gonna hit it exactly on target. So you want to err on the side of overreaction.
Yeah, it's actually something similar to, I work with robotics, and means that control theory is of some interest. And it's something similar to how we, let's say that we want to calibrate how the robot arm moves or how quickly a drone can take a turn, something like this. It's the same thing that you have to you can't go too fast, or you will lose control and you will crash. But you have to take the turn in a way that you can recover from it. You have to strike a balance between how accurate you can be versus how quickly you can execute it. And it's a fundamental trade-off, and it's something similar with this, that overreaction means it also has a time component. It has a magnitude, and it has a, let's say, hidden time component. That how quickly you react to something and how strongly, well, that's gonna determine your chances of survival, like you said. Will you take the turn, or will you crash and burn? So it would be a good idea to try to react strongly enough that you will make it, but because it's hard to assess what the actual risk envelope is, it's hard to see the wave until it's risen up. You want to compensate on the side of safety, and that's certainly is what I did, what you did, and people looked at us like we were crazy. But now it doesn't seem such a bad idea.
Yeah, the first thing I did was order some respirators.
Yeah, that was my first action as well.
I remember the thinking of like, oh, I don't really have time to look into this now, but maybe better get the respirators right now, and then look into it later.
Yeah, that's right.
And it was very. It was already pretty hard to get them. It was like Amazon was already sold out. I had to go to eBay, I think, and get some. Then
German eBay?
Yeah.
Okay, so at least kind of local delivery.
Yeah, and then I worried for a week if I would get them or not. And but yeah, I got them eventually.
Yeah, that's something I also told some friends who were rejoicing at having an order in, that you don't actually have them until you have them in your hand.
Yeah, it's
and indeed many orders got cancelled.
Yeah, it's like cash. You paid when you have the cash in your hand. You're not paid when you write the invoice or when they told you they wired the money.
Yeah. Now of course the respirators may not turn out to be that important, because really the name of the game is to just avoid people. But for those who don't avoid people for whatever reason, then they might want to stock up on those. I certainly bought by now hundreds of them, mostly not for myself. It was for sending them to people. I think about six European countries by now, who couldn't get them anymore. Because for whatever reason, I'm not exactly sure why, but for whatever reason in Ukraine, it was possible to buy respirators weeks and weeks after they had thoroughly sold out in continental Europe. And not only was it still possible to buy them, but the prices were still normal, which means a couple bucks per one.
But you mentioned now it's illegal, right?
Now it's illegal to export respirators. So not only in Ukraine, I'm sure.
Germany is the same,
yeah. So, for example, just last night, a mutual friend of ours who tried to leave the country and was turned around, as in couldn't get to Poland. The Polish didn't let him in anymore. In this attempt, he lost all of his personal protective gear, including the respirators, because they are illegal exports. So the Ukrainian border guards relieved him of them, confiscated them.
Shit.
And then the Polish turned him around. So that turned out to be an expensive waste of many hours in the queue.
And he didn't get them back, right?
Of course not. Yeah. That's not going to happen.
And I assume the respirators, they're probably going to go to the pockets of the border guards and not to...
Yeah, they're not going to go into hospitals. It's unlikely.
Yeah.
That's, by the way, another thing we should talk about. That there's been some really bizarre things that need more attention. One is this idea that you don't need respirators. I don't mean because of the reasons I just said, but rather you don't know how to use a respirator, so you will use it wrong, and you don't need respirators. Doctors need them. You know what I mean?
Yeah. I got really angry about this. It's so stupid. I mean, all the hospitals, they should have like put in massive orders in January. And apparently they didn't. And now like some politicians go around and talk about this, doctors need respirators and you cannot use them, just covering up their own stupidity instead of just, being honest and saying, okay, look, we fucked up and say the true thing. The true thing is that doctors need respirators more.
Exactly. Yeah.
That part is true. I mean, you definitely want all doctors to wear respirators, because if the doctors get sick, then nobody will get treated and then everybody's worse off. But saying that not wearing a respirator or not wearing a surgical mask is a bad idea, wearing one, is a bad idea.
It's a bad idea and it doesn't work. Yeah.
I mean, why did
what kind of double think is that? That who's gonna believe that? You would have to be exceptionally stupid to believe that.
And why did the Chinese run around and fine people or even put them in jail who didn't wear surgical masks? It's very simple, because if everybody out on the street wears a surgical mask, that automatically means that every infected person wears one. And that radically decreases the chance of infecting other people. So
yeah, that seems to be what happened in Hong Kong. That because everybody was universally wearing them, they did slow down the contagion enough that they have some semblance of control over the situation.
Yeah, exactly. I mean, just to be clear, like wearing a respirator makes it less likely you get infected yourself. It's not perfect. And wearing a surgical mask doesn't really help you getting infected, but it helps if you are infected, not infecting other people. So it makes total sense that everybody wears at least surgical masks.
Yeah. Yeah, it's one of those very, very strange things, and I see people repeating it mindlessly, that the respirators don't work, bro. you shouldn't buy them, and you certainly shouldn't hoard them, and just give them to the doctors. Go ahead.
Yeah, it's also a great example to see how the herd thing works. A friend of mine was accused of being a hoarder when he went to the supermarket with a respirator on, and he bought 6 eggs and 1 package of noodles. But since he had the respirator on, some other customer accused him of being a hoarder.
Mm-hmm. That brings to mind something on a lighter note, which is that have you stocked up on shaving gel?
I stocked up on these single-use shavers.
No, come on, they are really painful. You mean the Bics?
Yeah, something orange like that, yeah.
No, they are really, really painful to use. I wouldn't do that.
Okay.
If you value your skin. But
you need the shaving gel.
Well, the thing is, I'm sure you know by now that the beards are gonna have to come off. If you ever have to use the respirator, the beard is a no.
Yeah, I know. It's sad but true.
Yeah, and I actually had to already wear a respirator, not yet in a high risk situation, but more of a practice run, and certainly the beard is a problem. You can't achieve an airtight fit, and that means if it should come to that, the beard comes off. But I think I prefer the social distancing. It's not such a hard chore for us introverts.
Yeah, it kind of comes natural.
Yeah, so I would prefer to keep the beard and not use respirators. But not everybody is in that position. As you know, many of our friends, maybe most of our friends, are still actually unprepared. At the most, they have perhaps some weeks of food at home, and I doubt most people have even that much.
Well, since we're talking about preparation now, I mean, maybe let's go into a little bit into what we actually prepped and
practicalities.
Yeah, why?
Yeah.
So
one thing to sort of bridge between the previous and that topic. So I want to mention that when people make the risk assessments of the situation, they tend to be very dismissive of people who might have health problems, who might need medication which won't be perhaps available, who might need healthcare which would not be available in an overwhelmed situation, and also surprisingly, a lot of people are being very dismissive of the elderly. That it only kills old people. Well, that's okay,
yeah, right.
Yeah,
it's just Granny, you know. She's old anyway.
Right, and so similarly, there are other concerns that some of us have. So I live in Ukraine for some years now, and what can I say? You know, Ukraine has a lot of things going for it. Might surprise people to hear, but it's actually generally a really, really nice place to live. However, the single worst thing about Ukraine, something that I already noted way before the pandemic, is the healthcare. The state has monopolized much of the healthcare, things like surgeries and childbirths, and some vaccinations. And a public hospital is the last place I want to go in Ukraine.
In general, and especially in a pandemic, right?
Right. So that means that necessarily my contingency planning will be quite different from yours in terms of what demands and what reliance I could call upon on the healthcare system. That my planning doesn't include at all the public hospitals. Versus, you know, in a worst case scenario, you might go to a German hospital, I imagine.
Yeah, I mean, I try to avoid it, but of course, in a worst case scenario, I would go there.
Yeah. So this is just to make the point that you know, people who happen to live in a place where perhaps the healthcare system might get overwhelmed for some time, but then be able to compensate and life goes on. Shouldn't be so quick to dismiss the threat for everybody, because the real carnage is going to be in third world countries. And just like it was in 1918, you know, in 1918, something like 100 million people died. Nobody can possibly know the exact figure. But out of that, it was about 675,000 in the US and in America, and that was already a huge number. But compare that to 20 million in India, and the third world countries are going to provide the highest body counts on this one as well. And unfortunately, I do think of Ukraine as a first-class third-world country. I think my Ukrainian friends wouldn't be too offended at that if they are honest about the situation. So just to illustrate the situation here, the Lviv Infectious Diseases Hospital has currently messaged that you know, everything is under control. We are well prepared. We've been trained for weeks. And they proudly mentioned that they have 20, what is it called, isolation beds, 20 isolation beds, with plans to expand to 300. And they have a total of 4 mechanical ventilators. They don't have an ECMO machine, you know, a heart lung bypass machine, but they plan to order one, you know, post haste. And they have about 10,000 surgical masks and 200 respirators. That's the strategic stockpile for dealing with the coronavirus epidemic that's beginning in Lviv.
Wow.
Yeah, it's a little concerning. And the messaging in any case is, as it always is, everything is under control. Everything is under control.
Well, but on the other hand, you had to ship me antibiotics.
Well, yeah, this is very interesting, right?
This is crazy.
Yeah, so I have become the pharmacy of Europe. Because, as I said, there's a lot of good things about the Wild East, as I think of it, and one of it is that although it's a highly bureaucratic country ostensibly, the Soviet legacy, in reality it's more like the Wild West, and most things are obtainable, and it's not too difficult about anything. So I've been shipping respirators to our mutual friends around the continent, and I've been shipping some prescription drugs from European standards, but over here it's over-the-counter drugs. So that's helpful. For example, I might mention here, it's a good for anybody to know if they are prepping. There's a drug called chloroquine that is very promising in the treatment of the COVID-19 disease, and that is an anti-malaria drug and a drug for arthritis. And it would be a good idea to stock up on that if you can find it. In Ukraine, it's over-the-counter, but of course it's prescription in most EU countries.
Yeah, everything is prescription here. I mean, when I did my prepping and I got to the medical section, and there are these very good lists online. For example, the prepared.com website I think is pretty good. Yeah. And they have like these prioritized medical lists where they say, okay, these tools you need and these medicine you need, and to cover the most likely scenarios, not for a pandemic, but in general. And a lot of them, of course, are just prescription.
Mm-hmm.
And even things like paracetamol, it's not easy to get it in bulk.
Oh yeah, and paracetamol, we should mention at this point that India has restricted the export of paracetamol.
Yeah.
So most of the generics, of course, in the world are made in India, and some in China, most in India. And the Indians, of course, source the precursors from China. So ultimately, everything is rooted in China in any case, and that also means that it's one more example of secondary, tertiary effects. Pharmacies might very conceivably run out of some common medicines, common pharmaceuticals in the coming year. So shall we talk about the practicalities then?
Yeah, sure. Maybe let's start with location.
So you have a fundamentally different situation than I do. I'm in a house in the countryside, in an undisclosed location somewhere in western Ukraine, as I like to say, by the foothills of the Carpathians. And you, of course, are in Berlin.
Yeah, so I'm basically sitting in my apartment in the suburbs of Berlin. Didn't move into the container yet, so that wasn't really an option
right.
to go into lockdown there. And yeah, for me, the location question was one of the most important ones early on, because I figured that that's something I cannot change later. I have to make up my mind. And if I want to go somewhere else, then I have to do it early. And like if you look into general prepping theory, of course, then city apartments are not usually the place that is recommended to prepare for a shit hits the fan scenario. But for me, the reasoning was that I had a specific scenario in mind. I mean, I was specifically prepping for the upcoming pandemic, and I had very little time. So, and I still had a lot of stuff to do here. I mean, this prepping is very expensive. Economy is going downwards, so I kind of still have to earn money. And I figured if I go somewhere else, I'm gonna spend a whole month just basically moving. And so another cost added, and also income will go down significantly. So that wasn't really an option for me. And I think if one looks at it from the perspective of if you want to prep now, then unless you have a place to go, which is already made, or that's like, your good friends or your family or something like that in the countryside, I don't really see why you should go to a different location than where you are right now.
Yeah, I was a little surprised when you first told me that you're staying put in the apartment. But ultimately your risk is not that different. In terms of a threat model, your risk is not that different from mine. In that your main dependency and your main risk is electricity.
Yeah. And I try to mitigate that somewhat. Yeah.
Yeah, and so is mine, in a countryside house. In fact, over here we do have electricity outages most nights, not long ones, but a few seconds to a few minutes, and longer ones have been known to happen. So it's a concrete risk, and it's also one I wanted to mitigate myself, but there wasn't enough time for that. I was planning to install let's say an equivalent of a Tesla Powerwall, but that just didn't work out. So electricity remains the risk, and you have the same. So let's think about then. So for somebody who's just getting up to speed, and somebody who has never read a prepping book in their life, what would be your recommendations, Frank? Where to start? I would have to say it's probably not respirators really, and it's probably not toilet paper, but those seem to be the big optics.
Where to start? Like I said, first you have to think about the location. It's usually gonna be where you live, because you're not gonna move now. And also, of course, the name of the game, like you said, the name of the game is social distancing. And then you have to decide where do you stay put and with whom are you going to stay put. And you kind of have to lock that down. And then you kind of have to acquire resources to stay put. And that primarily means food and drinking water, and some personal protection, especially for the acquisition phase where you go out and try to buy all that food and water and other things.
Yeah, well, if you can't get all of that in one go, either because of logistical or economical considerations, then of course your risk will be increased in having to venture out a lot of times to get that.
Yeah,
especially as the situation worsens.
If you can get the respirators, sure, get them. What is more important, I think, what's really useful to get is these, is it called nitrate gloves?
Nitrile gloves, I believe.
Nitrile gloves, exactly.
It's the same as usual surgical gloves, just not made out of latex, so that latex can cause irritation in some people.
And also, like, even if you don't get respirators, just the basic mask helps you because it makes it harder to touch your face. Same goes for the gloves. It has this psychological effect that you're less likely to touch your face. And then, of course, try to get this disinfectant. It's very hard to get now, but
also sold out. Yeah.
But there's this WHO guide on how to make it yourself.
WHO in English, Frank.
Oh yeah, sorry. WHO guide how you can make it yourself, and it might be easier to still get the primers to do it yourself.
Yeah, I did that. We did that. So just got a bunch of ethanol, home production, let's say.
Yeah.
And very popular here. And then you need. You can get distilled water, but it doesn't really matter. You can just boil some water as well. and you need the glycerin, and what was the last component? Hydrogen peroxide, something like that.
Yeah.
Yeah, and you mix those in the right proportions, and you got yourself a decent homemade hand rub disinfectant.
Yeah, exactly. That's also
the WHO guide to local production.
Yeah, we're gonna link that in the show notes. There also you should have some goggles, because getting
What did you go for the goggles yourself?
I just get some. It's basically like for construction work.
Yeah, I looked at those, but I didn't really see any that were airtight. Did you find something?
Well, it's not 100% airtight on the sides, but I figured it's safe enough to have the direct impact covered.
Well, it certainly minimizes the risk, but the airtight would be preferable. So I went with swimming goggles for that.
Yeah, if you can get airtight, get airtight. Sure. That would be my immediate suggestions. So my method basically was, okay, I try to think about the scenario. So starting from the premise, okay, I have to stay inside the apartment for a long time. What do I need? And then, like I said, okay, it's basically food, water. If I have to go outside, I need protective gear. And then I was thinking through the scenarios, what could go wrong? So what can go wrong? Okay, electricity goes down. How do I deal with that? How do I mitigate the risks? So, okay, if electricity goes down, I can't cook because I have an electric cooker. So I got a gasoline cooker.
Yeah.
So I can
camping stove, I imagine.
Camping stove, exactly. So I can still cook. If electricity goes down, that means my freezer is gonna go off. And if the electricity stays down for too long, everything that's in the freezer will rot.
Might be useful to mention the time period.
Well, I think my freezer kind of, they say it's 40 hours, I think. It can stay off without defrosting, which is a lot. So I wouldn't worry about an outage of an hour or so. But still, I mean, if all my food, I got a shitload of frozen meat. So if all of that would go bad, then I have a problem. So
did you have a backup for that as well?
Well, what I got was cheap carbs. I don't really like to eat them, but I rather eat carbs than not eat for an extent.
Certainly both of our diets have changed a lot in the last few months out of necessity.
Yeah.
I remember your last visit here, we were eating grass-fed ribeyes, dry-aged grass-fed ribeyes by the ton, buying these stores empty, and those were the times, man.
Yeah, now
I will be
bought bags of rice.
Yeah, it's same thing here. A lot of kilos of rice, and that wasn't in my plan for this year.
Yeah,
I still refuse to eat the rice. The rest of the family does eat potatoes, rice, buckwheat, and I'm still sticking to my meat, but it's no longer steaks. And I keep saying that I'll eat the rice or the potatoes or the buckwheat when I'm starving, but not earlier.
Yeah, we're also trying to get into pressure canning. So it's a method how you can conserve food, and with pressure canning you can also conserve. So basically you put food into this sealed glass and you kind of cook it. That's what canning is. But with pressure canning, you do it under pressure. So it gets up to 120 degrees. And that way you could also conserve meat up for years, apparently.
How many years?
I found different numbers. I mean, some people claim it's 5 years. I must say I'm a bit hesitant. I'm like, okay, it's just like this meat in a glass, and that's supposed to be okay. So we kind of started experimenting with that and want to basically move some of my frozen stock into canned stock to deal with the possible problem that electricity goes down. And I think what's really important to think through, I mean, this is all already secondary. I mean, the most likely scenario is you're just going to stay indoors. Electricity works, water works, internet works.
Yeah.
I think that's what everybody should focus on first. But once you've figured that one out, then you can think about the other problems. And I think...
Yeah, now I would add to that list sanitation works. That would be nice as well.
Yeah, I was just going to get to it because if electricity goes down for extended periods, that usually means water goes down. And people usually think about drinking water, but the big problem is sanitation. You still have to shit, and you have to think about that before.
Yeah. So, and if you're out of toilet paper, you might want some water for cleaning too.
Yeah. And if you can't shower, then toilet paper is usually not enough. So basically what I got was it's like a trash bucket, but it has like a toilet seat, and then you put like a plastic bag in there and some sort of, I don't know the English name, some sort of material that kind of sucks in the humidity, what you use for pets.
Mm-hmm.
And so you basically have a off the grid toilet, and then I got a bunch of wet wipes. So then you shit in a bucket inside a plastic bag, and then you can seal that off and put in the trash. And I think that would work for a while. Mm.
Of course, going to the trash might require you to need a respirator. So.
Well, I mean,
up on those for that.
I didn't want to go into the details, but in a really shit it's the fan scenario, there's still the balcony or, the windows. So.
Well, and of course, questions about trash pickup and all of that, but never mind. Those are bigger concerns over here perhaps than in your hood. But
I don't know.
Okay,
but there's a way to get it out of the apartment at least. So
yeah. Well, okay, so you had a good start there. So you went through the food and water. You didn't mention anything about a water filter yet, but
yeah, I got a water filter and some this micro pour water, this water disinfectant thing. This
it's just calcium chloride or something like this.
Yeah, and then I got a bunch of food grade canisters, so I can fill up a bigger amount of tap water into the canisters and then make it disinfected with the micropore water, and then I have some reserve, so to bridge shorter outages.
Right.
I think for water it's really tough to deal with longer outages because just the amount you would need for that is really hard.
Yeah, the food is not the biggest problem. I've gone a few weeks without food, and it's not the worst thing.
But maybe I should mention that in general, my thinking for the food and also for the water was, and a lot of the other things, I tried to focus on stuff that I would normally eat anyway, or like water, and just get a lot more, so it doesn't go to waste. Other things like rice bags, that's more like an insurance, but the rest I would eat anyway, so it's not really a big expense.
Yeah, I think let's return a little bit. Let's take a step back and try to be more systematic here, as we usually are, except late at night, like now. So let's go back and discuss the threat model. Why all of these things? As in, what is the scenario and what is the threat model? And for the scenario, I think everybody should know it by now. As you already mentioned also, the name of the game is if everybody just stays in their apartment for some number of weeks, this plague will burn itself out. That's the theory, of course. There's some complications on it that we can discuss as well. But given the long incubation period and given the how long you can be sick with it, which is also a good stretch, and then the recently discovered viral shedding after recovery, which could be up to 37 days as well. That means that there's an extended stretch to stay at home if this is how we will deal with the threat. Of course, some people are opting to deal with it by trying to proactively get infected as soon as possible, but okay, never mind. Now, like you said, there's no particular reason at this stage to think that there should be large outages or additional disruptions in the holy trinity of electricity, water, and internet. But it's conceivable, of course. Not everybody is going to not all countries are going to handle this situation as well as some already did. So we are probably going to see worse scenarios than have been seen so far. Although Iran probably is a pretty good bad case scenario. The thing is, we don't know too much from Iran. It's also mostly bullshit coming out of the government, and the glimpses of what's actually going on past the great filter of Iran. They are scarce and hard to know what's true, what's not. So for now, my planning also is that I expect the water to continue to work. It's, of course, as you said, contingent on electricity. And I expect electricity to continue to work. Mostly, I might expect, if situation gets particularly bad, which it might over here at least, I would expect some more outages to electricity. And for the connectivity, the internet connectivity, well, there's multiple options for that, so I would expect at least one of them to keep working.
Yeah, just to make the reasoning explicit, so at least what I think is when you have a lot of people getting sick, it means a lot of people not being able to go to work. And all of these systems you mentioned, all of these grid systems, they need people for upkeep. If a lot of the workers are sick, then they might not be able to fix things in time as they usually do.
Yeah.
So, and then we have outages.
And also the planning, the capacity planning has never accounted for a situation where, for example, everybody's at home surfing porn. So,
yeah. I mean, that's another, like for the internet, we will see how well that works if everybody's sitting at home watching Netflix, or porn.
Yeah.
In HD, full HD.
That's right. 4K now, right?
Yeah.
So 8K monitors to land. So these kind of questions, and from those we mentioned, probably the capacity planning wise, the internet might have the biggest issues. On the other hand, for internet connectivity, there's usually a few options. You can always use your mobile internet as well, and maybe that can spread out the load a little bit. There were already some disruptions that I noted, or that somebody reported on, and we can expect more. So the electricity, water, and internet, the holy trinity of modern life. If we assume they continue to work, then we're in a branch of the decision tree where it's possible to make sensible choices, sensible preparations. If from those, especially the first two, if they go down or if they are severely disrupted, then we're in some other branch of the tree where things get pretty hairy. So my planning isn't too much about that. What about yours?
Well, like I said, I try to mitigate it somewhat, but only for short term, or mostly for short term. I think it's not possible to mitigate that for like weeks.
It's
I
not
mean,
to survive
especially the
without.
water. I mean, the sanitary situation would be pretty shitty after a while.
Yeah, and especially in an apartment, that would be especially hard in an apartment. You're not going to collect rainwater from the balcony, for example.
Yeah, and I cannot store like cubic meters of water here. So,
Yeah.
but I got
Now
the drinking water for like an extended period of time. But
I should mention that the pictures and videos from Wuhan early on were of many of them were of people queuing up for water with the gallon-sized tanks, trying to keep a distance of a couple of meters between them.
I think also to clarify that on the more likely side of the decision tree where the Holy Trinity keeps working, what I want to prevent is having go to the store a lot.
Right.
Even I don't suspect that there will be major food shortages. It's most likely you can get food, but it's in the part of the pandemic where a lot of people are infected. It's obviously high risk to go to buy food. I mean, that's the riskiest thing you can do. Is go outside at that point. I mean, it's a totally different risk to go to a shop than if you go outside and take a walk on yourself or with somebody else.
I should mention that even though we are on lockdown, we are in the countryside, so we do go for walks outside the property. And the idea is just we don't meet anybody there.
Exactly, you try to avoid contact.
Yeah.
And you're not really touching anything when you're walking outside. So
yeah, of course you have a different situation in that you have to go through the common hallway, the shared space.
Yeah. That's something I'm very conscious of. That.
Yeah, and so you should be if this or when this grows to be a widespread contagion in your neck of the woods, then you might want to take some measures for going through that space. Might be worth mentioning for listeners that the microscopic droplets that spread the disease can hang in the air for a few hours and be infectious for a few hours. It's not the best idea to be, for example, utilizing an elevator that was used by infected people sometime before.
Yep.
So you and I both, we decided that it's not too feasible to plan for the scenario where we have the basic disruptions of these utilities. We didn't have that much time, and it needs a whole different level of bug out to do that.
Yeah, I must say this whole thing, although I'm probably now pretty well prepared compared to most people, it kind of caught me, how do you say, cold-handed? That's the expression, right? It kind of, caught me cold-handed. Because I was always...
Which part?
I was always interested in prepping. And I was always planning on prepping more, just for all kinds of, shit hits the fan scenarios. But I never really executed that much. And then when I started 6 weeks ago, I realized how much harder it was. I think
than what you imagined. Yeah, that's the same experience for me as well.
No, not just like how much harder it was than I had imagined. Also, how much harder it was because it was on such a short notice, and it was getting harder to get things. Like the respirators, for example.
Right. Yeah.
It would have been so easy to stock up on all of this stuff. Or, for example, the ridiculous situation that you had to ship me antibiotics from Ukraine, although I was in Ukraine in January.
Sure.
I should have just bought all the prescription medicine that a normal prepper needs. I should have just bought it in Ukraine when I was there, but I didn't.
I figured. I figured that if you had stayed for one more week, you probably would have made many different kind of decisions, because you were around exactly at the time prior to it being really clear that you needed to take some actionables. And
sure, I probably would have taken the medicine then, but
and also perhaps about location, you would have also had other options still at that point. And of course also about travel, that you know if you had stayed longer, you would be more hesitant perhaps to go back via the airplane, especially now that we know how early some of these infections in Italy, Seattle, and so on have happened. For example, just as a point of note, in Spain there was a coronavirus death already 2 weeks prior to the first confirmed case in the cluster of cases, 2-3 weeks back, and that was just marked down as pneumonia, but in later investigation turned out to be corona. So that goes to show how it was already spreading in Italy and elsewhere from the end of January and beginning of February, certainly. So, a lagging indicator. Okay, so for the food and water, you didn't really mention specifics. For the carbs are easy and cheap. I mean, carbs are shit, but it's cheap energy. So for me, I stocked up on organic potatoes from the countryside, some hundreds of kilos, and stocked up on rice, stocked up on buckwheat, very popular here, buckwheat, not a favorite. And then to actually be healthy, it's all about meat. And I went for the same strategy as you, as in a big freezer, newly acquired, full of meat. And at the same time, a plan B for should we lose the freezer of canned meats. Now I was able to find something similar to what you're producing yourself, as in canned meats, beef and pork in glass jars without any added shit. And I got a bunch of those. But they're relatively expensive, of course, so the pressure canning is a good idea if you have manpower resources for it.
Yeah, it's very time intensive.
Yeah. And I'm certainly interested in that if there had been more time, but there wasn't. And now it's too late to get anything.
Yeah.
With regards to that.
Yeah, for me it's very similar. Like a lot of cheap rice, a freezer full of meat, basically bought half a cow. And then I got just some cans from Metro, like beans and some veggies and some fruit. Yeah. It's mostly for to get some variety. If I have to switch to more rice, then I think just rice would be a bit boring. So
yeah, to say the least.
Yeah, and also I got a lot of salt and some pepper and stuff like that, spices.
Yeah, that's a good idea.
Yeah,
especially salt. I think I have 25 kilos of salt, something like that.
That should be enough.
Yeah, well, it was the unit size for the larger units, so
yeah,
easy thing. And actually something maybe to mention is that so as of today over here in my neck of the woods, all the stores all the businesses, shops have been forced to close, other than supermarkets and pharmacies and gas stations. And the deliveries we still had in flight. I should mention, we have a whole system of disinfecting deliveries, so deliveries are okay. The deliveries are all delayed because, as it turns out, there's a massive surge of deliveries. So both the courier companies as well as the suppliers, the vendors. So, for example, Metro is here too. They are all, at least momentarily, overwhelmed. My wife called Metro today to inquire about one order, and they said that it will be at least 4 days late because they are just inundated with orders. and they don't understand why.
Really?
At least the lady she was speaking to was sounding surprised about the situation. But it's a perfectly predictable situation.
Yeah, I mean, when I was buying my cans, I don't know, it was a few weeks ago, 2 weeks, 3 weeks ago. I went to Metro and the clerk said, oh, it's all people buying today, just cans. I don't know what's happening.
Right. It's nothing in the news. That's the thing, right? It's nothing in the news. What could it be?
Yeah.
Yeah. So in terms of the food, I think that's probably mostly obvious to everybody, that buy something long lasting, buy something which will keep, as far as possible without any refrigeration, and try to maximize the energy per dollar, for example.
Yeah. Oh yeah, I must say one thing, what I thought about was, okay, if I have meat and I have even cheap carbs, what do I need a lot from is fat.
Yeah.
So what I went for was ultimately a lot of butter.
Yeah.
And then
it makes sense.
I put the butter in the freezer, and then when the butter, I mean, it's only good for like half a year or so, but you can also make it into ghee later. And that has a much extended shelf life. So I figured that's a cheap way to get a lot of fat. And because the other option I saw was olive oil, but if you go for the cheap olive oil, you never know what's in there. So
even for the expensive ones, you don't know how adulterated it is.
Yeah.
Even 60% of olive oils on Italian shelves are adulterated with other industrial oils.
Yeah, exactly.
So it's risky.
So for me, it was cheap butter. Basically going to Metro, buying the cheap German butter, and that's probably the best fat you can get, and for that price.
Yeah, it's a good idea, but and I kind of tried to do something similar. But the thing is, we go through a lot of butter per day, like two or three packs at least, and so that's not a scalable strategy. Still figuring out something else to do about that. I do have a lot of butter in the freezer as well.
And it's very space efficient as well.
It stacks up nicely.
Yeah.
But it would be nice if deliveries continued to work, so that, for example, wouldn't have to run out of that. As it is, it's definitely going to run out eventually. Well, one thing we didn't discuss at all yet is the time component. So I think right now, people, even if they in the last week or two stopped laughing, so to say, and stopped repeating this mindless, it's just the flu, bro, there's nothing to fear but fear itself, these kind of things, then in any case, they are still expecting that this will be over soon. They are still expecting, and authorities are still telling them that it will be over soon. It will, prepare for maybe a few weeks indoor stay.
Yeah, man, this never stops to amaze me. It's like, okay, now they realize it wasn't complete craziness, but they still expect it to be over.
Yeah.
In like 2 weeks or a month. Even a lot of the emergency measures introduced, they have a very short timeline. Like the emergency thing they introduced here in Berlin on Saturday. So things like bars are not allowed to open and clubs are not allowed to open. It automatically expires in 1 month.
Mm-hmm.
And I don't really expect this thing to be over in a month. And you can see in Wuhan, it wasn't over in a month.
Yeah, I think it was people staying at home close to 50 days, something like this. And of course, that's the thing. I mean, it would be better right now for people to try to understand what's actually going on instead of just listening to the authorities who are, in one form or another, they are repeating, "Don't panic, everything is under control." When of course it never is. It never is. So China is looked upon as having beaten the virus, and certainly they are, taking the propaganda victory of it, including beginning to shift blame. Apparently the domestic messaging is now there that it's an American virus created in an American lab, because it always needs somebody, and if you can blame somebody else, even better.
Yeah, it's always better if you're dealing with a foreign virus than with a domestic.
That's right. That's right. Yeah, and of course, in Iran, the bottom line is that it's a Zionist conspiracy. It's a Zionist virus.
Yeah,
something like this. It's very funny.
Virus doesn't care though.
Yeah, virus doesn't care. And in China, it's by no means the case that this is over. They've for one thing, we can't really trust the figures out of China. But even if the trend that they show is correct, even if they damped down on these flames, in any case, once China resumes work, once China resumes life, this will come back. There will be another wave, and we already see this in the cases being re-imported into China from passengers from Italy, Iran, and everywhere else. Many cases of that already, of infections coming back from abroad, even if they managed to somehow domestically stamp it out altogether. And the same, of course, is going to be true for everyone, that unless you 100% stop travel to elsewhere, whatever you define as here and whatever you define as elsewhere, then you can kill it certainly by this self quarantine, this social distancing. But how you gonna really stop it? And the answer is not too easily. It's a lot more difficult than people think. And right now, I think most everybody who's preparing, they're still preparing for a few weeks to a few months. And I think it's going to be a little bit more complicated than that. And I believe you're there as well.
Yeah, I mean, there's certainly the risk or a high probability that it becomes endemic. And you already mentioned, I mean, there might be multiple waves. And we probably see a lot of changes. And I mean, even if the countries who deal with it very well, so you have an outbreak, you do heavy containment measures, you do a lot of testing. I mean, I think that's fundamental if you want to deal with the problem, that you have to do a lot of testing. And also, unfortunately, you have to do a lot of tracking. So every infected person, you have to try to track who he had contact with and then test these people as well.
And contact tracing.
Yeah. And when you do all of that, then you get the situation under control, but then you have the problem that you have to prevent reintroduction of the virus from other countries.
Yeah.
Right. I mean, that's basically the problem China has now, that they have now to make sure they don't get it from visitors from abroad.
Yeah, and it seems to me that what the Chinese are pursuing now is they're trying to scale contact tracing. They're trying to automate contact tracing. As in, contact tracing is a labor-intensive effort that can be used in an early stages of an epidemic, but later it will just fall apart, as we have seen. What the Chinese are doing now is they seem to try to be using technology because they do pretty much track all their citizens in multiple ways, including on their phones. So they have some idea of where citizens are at all times. They can correlate information from their phones, everybody's little personal spy, with what they see from the 800 million surveillance cameras deployed in China. Many of them, or increasingly many of them, increasingly many of them are smart cameras, as in they have face recognition and the like. When I was recently in China, I was certainly impressed by the number of cameras and the billboards that show jaywalkers and the like. So they are trying to create some system that will allow them to retroactively see who did this person come into contact with just based on technology. So that would scale. It wouldn't be such a labor-intensive process. And if that worked out, that would be helpful. Of course, it's also a dystopian nightmare.
Yeah.
You and I, Frank, we were recently discussing this new study from China, where they determined that the virus might spread even 4.5 meters in a bus. If somebody sat in a bus, one infected person sat in a bus, and this wasn't a hypothetical, of course, they actually looked at real cases. So infected person comes into the bus, he sits somewhere in the back, and he infects, half a dozen people in that bus.
We must add, though, that it was a long distance bus. It was like a 12 or 24-hour bus ride. But yeah.
Right. But in any case, he infected somebody 4.5 meters away, and he also infected somebody who came into the bus half an hour after he had already left the bus. So it was pretty impressive. But what was even more impressive for me was how they could do such a study. And the reason they could do such a study is that the buses have cameras. Plus, they know, as I said, they know where citizens are at all times. So they were able to almost time travel. They were able to start from a known case and trace the movements all the way back, look at all the buses, see who else sat where, and did they get infected or not. It was an extremely impressive effort, and to me it underscored how much surveillance you would need to pull that off. I think actually this study was, or this paper was retracted later, and one might wonder if the capabilities used in it might have been the reason for that. I haven't looked into that yet. But perhaps China might do something effective in scaling or automating contact tracing to try to control the coming waves. But it's not a given that they can succeed. And it's not any solution to keep the country on lockdown unless we transition to a permanently remote economy.
Yeah, but it's definitely very concerning because you can see the appeal from an engineer perspective, right? Like you said, you don't want to put the country on permanent lockdown, but you still need to prevent the flare-ups. And then you're automatically gonna do contact tracing, and they already have their social scoring system. And then what you could do is like, okay, somebody got infected, you contact trace them, and then you put people on specific quarantines who had contact with that person, all automatically. Because you sit next to an infected person, or maybe you get tested, and basically you're, the government AI tells you if you're allowed to leave your apartment today, or if you should get a test.
Right.
And that way you could kind of scale it up without the huge disruptions that they had to do like now.
Yeah, and of course something similar, a little bit similar, apparently was used in South Korea as well, where people could track from a map, they could see where infected people are at the moment.
Like here in, I think it's just a Berlin-specific law, but might be in other states of Germany as well. So they outruled any events with more than 50 people. But if you do an event with less than 50 people, even if it's a private event, you have to create a list with all the names and addresses and telephone numbers of all the attendees. And then when the health agency asks for that list, you have to give it to them. So they still try to do it at like totally old school. And like you said, this will break down so quickly. And people are not honest, and they forget it, or...
Yeah, and why would they be honest? It's not everybody enjoys the idea of being on such a list.
Yeah, exactly. And there's a ton of events where
for the greater good. Yeah,
don't want to put your name on the list, but yeah, it's very unfortunate. But there's a lot of pressure into the direction of more surveillance.
Yeah. And as we well know, temporary measures tend to become permanent. So
Yeah.
we have yet more tertiary effects from all of this to deal with in the future.
It's also
scaling
used
back the state.
Also used already to push the ban on cash forward.
Yeah, that was interesting. In case listeners don't know, in China they destroyed billions of yuan of cash in Wuhan and Hubei province, and reissued it because of concerns about contamination of cash. And given how long the virus can survive on surfaces, maybe not without concern. I guess we'll find out in the next months to come. But certainly it's a given that there has never been such a good opportunity for states to ban cash, which they want to do in any case.
Yeah, and some businesses are now even doing it proactively. I read that there are some chains that are basically said we don't take cash anymore because of the virus.
Yeah.
So that's
it's a bottom up effort as well. That connects with the state's top down desires. So, more effects. But the way I went on all of this tangent here was that to come back to practical preparations is that this won't be over soon, and people are underestimating still. So even if they've gone through the acceptance pipeline, as a mutual friend called it, they've dealt with the various stages of grief or whatever they need to do. In any case, they're still expecting this to be over soon. And there's actually not that much reason to expect this to be over soon.
When do you expect it to be over, if there is an over at all?
I don't really have a clue, but it won't be soon. And some of the reasons for that, a lot of people are placing a lot of hope on the vaccine. And I did initially as well. But the more you look into the vaccine question, a vaccine is something that you inject into a healthy population. And that means it needs to have virtually no undesirable side effects, severe side effects. So it means you can't really rush the vaccine development, or rather, you can develop vaccines, but then the trials after that. And we have a lot of headlines in the last month about vaccines being developed in 3 hours, 3 weeks, whatnot. But and people are sharing those as if it were some kind of cure. But the reality is that a vaccine is very far away at the point of delivery. After the trials, there's the manufacturing and distribution, and who pays for what and so on. It's anybody who's hoping for a vaccine for less than 12 months hasn't really considered the question. And 12 months would be at the extreme level of optimism. Further, it's not necessarily the case that a vaccine will be that easy to develop, given that there are seven coronaviruses that infect humans. Therefore, seasonal ones that cause the common cold, or some of the common cold. There are also rhinoviruses and the like. And then the others are, of course, SARS, MERS, and this present plague affecting us. And there's not a vaccine for any of them, despite 15 years of development of a SARS vaccine and a decade for MERS. There are no vaccines. So it's not a given that a vaccine will be feasible. It's also about you know that the flu vaccine in any given year, it's not that effective. It's 20 to 60% efficacy, varying because they have to try to predict how the virus will mutate, how the strain will mutate, and it's going to be the same for this. It's a single-strand RNA virus. It makes on average one error per every copy. and it has a high mutation rate. It's going to have antigen drift, as it's known, and it's not going to be the easiest thing to stop in its tracks. So a lot of this hope in vaccines right now is it's more like a, how would you say? It's more like a pipe dream than something that anybody should be counting on. Vaccines will be great if and when available. That's not going to be anytime soon. And so then once you accept that that's the case, once you accept that there's no easy fix, then you start to look at the situation more realistically, as in what you're going to do. What is anybody going to do to stop it? And that's where I'm coming from, that I think the scenario to plan for is, some people actually I think that they should get infected and get it over with, and then they're good. And if somebody wants to roll the dice that way, by all means. But for the rest of us who would like to avoid infection for as long as possible, so I'm not saying avoid altogether, I'm not saying avoid as long as possible, until more is known, more treatments are available, the hospital capacity surge hopefully has been dealt with, capacity has expanded, and so on. For those who would like to avoid infection, it will be a long stretch. I'm thinking at least, my planning is based on at least half a year. And I think that may even be over-optimistic.
Yeah, I also agree with the vaccines. I look at it, it's kind of like a lottery ticket. If we win the lottery and we really find a vaccine that works globally on all the strains that will be around by then we really won the lottery. But that's not something we can count on.
Yeah, that's a good way to put it.
Like you said, the clinical trials, they cannot be rushed. Then you have to manufacture it. Then you basically have to vaccinate the whole world. That's a huge effort in and of itself. And
who gets the vaccine first?
Yeah, and it has to work on all the mutations that will be around by then, which is also very unlikely. So, as far as I can tell. Yeah.
So, by the time the vaccine is available, the way it looks right now, by the time the vaccine is available, whatever is going to happen has mostly already happened. If you're talking, let's say, an 18-month time frame. And that's pretty much a best case. So, if you're planning for the next 18 months, it would be prudent to not make it contingent on the vaccine.
Yeah.
And I'm not counting on the vaccine for that.
Yeah, it's kind of hard to plan for staying in your apartment for 18 months.
That would suck.
That would suck. But it is kind of prudent to plan for a world with coronavirus for at least the next 18 months.
Right.
With,
so, for example,
intense phases with a lot of lockdowns and a lot of infections.
Yeah, and maybe it's a good time to mention that we can learn a lot from past pandemics, of course, and the most interesting one perhaps is the 1918 pandemic. And in 1918 there were 3 waves of this influenza strain. And the first wave, in the spring of 1918, circumnavigated the globe in less than 6 months. You have to keep in mind at the time it was mostly passed around the world through ships. There wasn't that much air travel going on, certainly no long distance. And it wasn't particularly severe. It was less severe than COVID-19. It was so mild that doctors didn't think it was influenza, because influenza was known as something more severe. However, that all changed in the late summer and fall of 1918, when the second wave hit, seemingly simultaneously around the world, and that was very lethal. For the next 4 months, that was absolute carnage. 4 or 5 months, And what had happened is that the virus, after having passed through hundreds of millions of human beings, and in each case making billions or more copies of itself, it had fully adapted to man, and it had become more viral and more lethal. Now, it's not a given that it should become more lethal, but in that case it did. And that is worse than the current situation, but it's worth keeping in mind that the first wave was less than the current situation. So it's also, when people think about the risk envelope here, I have seen very few people, at least until the last week or so, even mention the possibility that we might have future waves that are more lethal than this. And yet it's guaranteed that the more copies the virus makes and more human host helps in that, the better adapted to man it will become. Now, probably it will go in the opposite direction and become less lethal. As you said, it will become endemic over time. But that's not a given. It's not a given. It's not what happened in 1918. Now, the third wave in 1918, and that was already more 1919 and 1920, that was more lethal than the first wave, less lethal than the second one. And that was somewhere in between. So there was the virus having been too successful in the second wave, as in it killed so many hosts so quickly that its spread was impeded. And as a result, strains which were less lethal were selected for. Plus, of course, there was the whole question of social distancing as well. So it was a better trade-off to be less lethal. It could still spread for a couple of more years. And so there was a pandemic that was at least 2 years in duration. There's some a longer stretch in some places, and it would be prudent to plan right now, given that at least everybody right now, unlike a month ago, is aware that something worth paying attention to is going on. It would be prudent to plan for a worst case scenario of a couple of years in some form or another, and perhaps in such a time frame there might be a vaccine, and perhaps not. And so if we finally circle back to practical preparations, of course that's a very, very difficult thing to prepare, for example, economically for 6 months even.
Yeah,
like you said, it needs a big freezer, and a plan B would be good too.
Yeah, and the shelf life in a freezer is not 2 years, that's for sure.
Yeah. And plus, of course, really the money question that how many people can afford to stock up for even 1 month, given the savings rate in most Western countries today.
True, yeah, and that will also become more difficult when people losing jobs and economy turns down. I mean, there's already a lot of people basically out of jobs right now because events have been cancelled and tourism is totally breaking down.
Yeah, in terms of the secondary and tertiary effects, wow, yeah, the waves of bankruptcies have already begun. I know many people going out of business, and of course my own business has been affected as well. I was supposed to be on fundraising tours right now, but that is postponed for at least half a year.
Yeah.
We will see. So the airlines are letting go, as you probably saw in the news.
Yeah.
Norwegian Air let go 90% of its employees, cancelled 80% of its flights. A lot of this going on.
Yeah, there will be some major changes afterwards, I suppose. It's like businesses going out of operation, and also things like remote work being more accepted, and
some permanent changes, hopefully.
Yeah, some for the better and some for the worse.
Oh yeah, some definitely for the worse.
Yeah,
But so there's so much to talk about all of this that we kind of keep escaping the practical preps. But you wanted to have it as a focus, so let's talk more. You talked about the personal protection in case you have to venture out, and of course for anybody who's unprepared right now, they pretty much have to venture out to secure the supplies they need. And as a result, let's talk about personal protection. You already mentioned the goggles. I went for swimming goggles there, and I think that might be a good idea. Of course, swimming goggles might have problems with fogging up and the like, but swimmers deal with those. So there's anti-fog spray and whatnot. And a respirator would be good. A surgical mask is virtually useless, but not totally. And you didn't yet mention rain ponchos. After you come back from out and about, you would want to be able to disinfect yourself. And it might be a good idea to wear a poncho.
Yeah, I mean, if you cannot get like a whole body protection suit,
well, you probably wouldn't go to the supermarket with that, even if you could. I don't mean necessarily the fashion statement, but you might get mobbed. You already said somebody accused of hoarding just because of having a respirator.
Well, I mean, these things, they tend to change very quickly. So maybe 2 weeks from now, it's accepted normal. It's hard to tell, but yeah. But like you mentioned, a poncho is a good compromise to like these rain ponchos where you have something to disinfect afterwards.
Yeah. In my case, I don't even try to disinfect. I just bought a bunch of them, the cheapest one, and they're just disposables.
Yeah.
Then you mentioned the gloves, and certainly I think the gloves are even more important to begin with than respirators, because most people are going to get this from surfaces.
Yeah, I think the gloves are the most important one, yeah.
Yeah, and they're going to sell out, so might be a good idea to get them while you can.
Yeah.
The surfaces we should mention perhaps, this virus can be on surfaces in contagious form for at least a few days. There's some information that indicates even much longer, up to 9 days in some cases, but let's call it a few days, depending on humidity, temperature, material. It's going to be a lot of things like elevator buttons, handrails in apartments. There's buttons on ATMs, bankomats. There's any number of places where you can get infected, and the gloves would be the easiest way to avoid a lot of that. So I treat them as, of course, disposable. They are disposables. You put one on, for example, if you need to go to the ATM, take out some cash, and with one hand you do your thing, press your buttons, and you probably want one on both hands, because at some point you want to treat the cash as contaminated as well and put that into a bag. So that's working our way from the head down. Then when you come inside from the outside, might be prudent to think about your shoes, where all have they been. And for that, I got rain boots.
Mm-hmm.
Rain boots are trivial to disinfect compared to any other kinds of shoes.
Yeah, that's a good choice.
Yeah, those I don't treat as disposable.
Yeah, it's too expensive.
So that's protection, and of course there's more that could be done, but some reasonable level for the coming months. It's not too bad of a start. It's going to be difficult to source the respirators for sure. If people don't already have them, I don't know that they can get them. Not sure what can be done about that. And I suppose local production ultimately. I saw some news that in Slovakia they already began domestic production of face masks, at least, by repurposing existing production capacities. And so personal protection, food, water. We talked a little bit about power. you have, of course, in an apartment, not that many options. In the countryside, there's more options. I got some solar panels. I got propane. I got butane. I got the camping stove, as you did. Got some space heaters that work on butane and propane. Got gasoline. Got diesel stocked up with fuel stabilizer, of course. Good idea for any extended crisis. Got firewood, 8 cubic meters. There's options for fuel and redundancies so that we can handle most any situation for power. And especially in all of this, the planning taking into account that, okay, winter is almost over now. It's nice spring weather, nice spring day today, but there will be next winter also. And it's by no means a given that this will be over by then. So.
True. Yeah, I think we covered the basics pretty well.
Yeah, for sanitation, we haven't really covered toilet paper yet, but that seems to be a very popular topic lately.
I don't know why, but it's a deep-seated human fear to run out of toilet paper, I guess.
Evidently.
Yeah.
So
get some toilet paper.
Yeah, and for maybe a basic pro tip, you might not be able to call the plumber in the next month, so you might not want to. So if you might want to be able to deal with toilet problems yourself.
Yeah, get toilet paper, but go easy on it. Don't use too much.
Maybe use double layered instead of quadruple layered.
Yes.
Don't clog up the works.
And get the cleaning device to unclog the toilet yourself.
And the chemicals for it and so on. That's what I mean. But, it would kind of suck. It would suck to be stuck with a stuck toilet.
Yeah, and get the wet wipes, man. Get the wet wipes.
Yeah. By the way, I mean, pro tip: alcohol-based wet wipes, which are the kind you want for disinfecting this virus. Those are selling out. That's going to be hard to get. It's already hard to get in many places.
Yeah.
And disinfectant, as mentioned, is virtually sold out everywhere. So have to make your own. It's thankfully not that difficult to buy the precursors for making your own.
Yeah.
Mostly ethanol.
Yeah, we're gonna put the link in the show notes. I think for the medical, the list from theprepared.com is pretty good. I also gonna put the link in there.
Maybe you would want to explain to people why I shipped you antibiotics for a viral disease.
Well, the thinking there was that if the viral disease goes bad, then you get secondary infections like pneumonia with bacterial infection, and then you want broadband antibiotics.
Yeah. So
you maybe don't want to go to the doctor, or you can't go to the doctor because they're overwhelmed. So I wanted to have it.
The thing to plan for in this case is that the virus causes viral pneumonia in case you have a severe reaction. So including up to a condition called ARDS, where basically your lungs have a very hard time and you are unlikely to survive. Used to be 100% fatal. These days only 50-60% fatal with ICU care. So if you get viral pneumonia, it means that very often it could happen that you would seem to recover, so you beat the virus, but the virus has already depleted your immune system so much that the bacteria that normally live in your mouth and throat and are kept in check by your immune system, they are able to wander down into the lungs and virtually defenseless lungs. And at that point, a few weeks after recovery, you come down suddenly with bacterial pneumonia, and that can be fatal. So that might even have been a major part of the deaths 102 years ago. That this false recovery happened a lot, and then boom. They didn't have any effective antibiotics then, but we do now. So maybe you want to mention, Frank, the ones that you would stock up for this situation.
I don't recall the names out of the top of my head, to be honest.
Right. There's a bunch.
Do you remember?
Well, there were three kinds we considered, right? So doxycycline as a general basic antibiotic for most needs. It's not only about pneumonia; it's also, you're not going to be able to necessarily get hospital care, see a doctor for some stretch, and you can have other reasons to take antibiotics than just this. So doxycycline is a good generic for that. And then you mentioned Bactrim, which is not the actual active ingredient, but a brand name. And then we had a more complicated one for respiratory diseases. Let's see, can I look that up easily? Not too easily, but you can add that to the show notes. So
yeah, that was the one for pneumonia, bacterial pneumonia, right?
Yeah, and we can add that to the show notes. And then for the medicine cabinet, the thing we already discussed, that India is restricting at this time, as far as I know, 26 different medicines or pharmaceuticals, including surprisingly paracetamol, and that list might grow. China restricted personal protective export, PPE, personal protective equipment exports already more than a month ago. It's conceivable they might restrict medicines in case they need it for future waves domestically. It might be prudent to stock up on some general medicines.
Yeah, and we didn't mention it, but it's very important if you take any medicine regularly, prescription medicine, you should just stock up on that. Get a few months supply of the stuff you have to take on a regular basis.
Right, and a lot of people are using painkillers, so maybe it's a good idea to mention that the other day, the French Minister of Health, he announced that the French ICUs have been seeing a trend wherein use of ibuprofen and other non-steroidal anti-inflammatory drugs like aspirin as well has been a risk factor in these severe cases. And that's not been confirmed in any way by any study, but if that's true, then it might be a good idea to prioritize paracetamol instead of, for example, ibuprofen.
Yeah, definitely good to have all the options and keep tabs on the current developments in case you get infected, what the best treatment is if you have to treat yourself, which is very likely.
Yeah, plus there's some very complicated questions such as pregnancy. So in our case, we have in the house a pregnant young lady who is due to give birth in some months from now. And it's very unlikely that she can do it in the hospital as she normally would. It's very unlikely that hospitals in a few months will be a place anybody would want to go to. Even in the best of times, Ukrainian hospitals, as I mentioned, are not really my favorite places to go. So we are preparing for a home birth on that count.
Wow.
And that's certainly somewhat scary of a prospect for all concerned. I try to approach it from the point of view that billions of women throughout history have given birth at home, and that most of them survived. But it's definitely not what anybody had plans for. And there might be a common scenario this year. And of course, any number of 1,000 other scenarios where you just can't assume necessarily access to healthcare resources, as we are hearing out of Italy already.
Yeah, that's the big secondary effect problem, that things that are usually not a problem suddenly become a problem when the healthcare system is overloaded.
Yeah, exactly. From Hubei province, there were many tragic stories of people who couldn't get the treatments for their chronic problems, of children who couldn't get the cancer treatments they needed. It's gonna go ahead.
How are you preparing for the home birth? Have you figured it out yet? Or?
Well, it's not my primary responsibility, but the young couple is sourcing books on the question, and also consulting remotely with midwives. And
that sounds like a really good idea.
Yeah, it seems like a good start, but ultimately there's nobody in the house who has any experience with childbirth from the midwife perspective, and it is certainly a little bit of a stressful situation. You know, as I said, mostly the odds are good, but on the other hand, in my own case, with our first child, we had some complications which, if it had been a home birth, would have probably resulted in death of both child and mother. So it's easy to play the odds until your hand comes due. So,
well,
yeah, that's a difficult one. But really, it's going to be a common situation this year, and people might want to think about that. Of course, it's also there's a flip side to all that, which is that one of the things I stocked up on and often neglected in the rush for the toilet paper, condoms.
Yep,
it's better than board games. I know you stocked up on board games.
Yeah, you saw the memes going around about the Corona babies and Corona girls and all of that. Yeah, it's better to have them. And also there's necessary sanitary items for women, of course.
Yeah, sanitary pads and the like. Yeah. And of course, in terms of tradables, if neighbors need them or friends and family, might be a good idea to have some high demand things like this.
Definitely.
In prepping books, they would also tell you to stock up on alcohol and cigarettes and other such tradables. I have to admit that actually I had that on my to-do list, but I never did get to it. So we have no alcohol and no cigarettes in this house.
I think I got 100 cheapo lighters.
Lighters I got, but cigarettes I haven't.
Yeah, me neither. But yeah. Well, I mean, I think we covered most of it, and I think it's a good time to kind of wrap it up and maybe do another episode.
Continue another time.
Yeah, do another episode in the future and about future developments, and also people can send us in some questions if they have any specific questions on preparations we did. I mean, we're not the foremost experts in prepping, we have to add. I mean, we also just kind of got into it heavily this year.
Yeah, I would really recommend what you already mentioned, theprepared.com. That's John Stokes is the one of the editors on that. He was the founder of Ars Technica. Some people might know him from that. And that's really an excellent website.
Yeah, they have a good common sense approach to prepping, not this zombie apocalypse type. It's more proper risk.
It's more like prepping for the rest of us, right?
Yeah, the rational approach to prepping.
Yeah, and they got good guides specifically about the coronavirus situation.
Yeah,
and there's a few others we could add, but that's a good start.
Yeah. Okay, before we wrap up, is there anything else you wanted to add or tell our listeners?
Oh, there's tons to talk about, of course, but I would say that there's really one great book recommend. Of course, you know me, Frank. I got many good book recommends.
More than I can ever read.
I know you quit Goodreads because of my recommendations. I say. But the single best recommendation right now might be the Great Influenza, John Barry's book. That's the epic story of the 1918 pandemic, and it's very, very educational. The parallels to today are fascinating. Now, of course, back then they were dealing with influenza, and we are dealing with something which is not influenza. But in any case, we are talking about a highly virulent single-strand RNA virus with high mutability, and something that will definitely leave an impact on history. In 1918 too, they told people it's just the flu, bro. The authorities told people it's just the grip. I guess in German that makes more sense than in English these days.
Yeah, German, we still have the word Grippe.
Yeah, and it's not a very familiar word for English speakers anymore. But they also said that it's the plain old influenza masquerading under another name. It's just the grip. There's nothing to panic about. There's nothing to fear but fear itself. I have a nice Twitter thread with screen caps from the book on all of that craziness. And it really struck me in the last weeks how similar the messaging is. Some things just don't change.
Yeah.
But nobody's... Yeah, go ahead.
What I also found really educational was 3 seconds to midnight.
Yeah. That's I'm reading that right now, and that is another great recommend.
And it has some sections on which are very US specific, but the general sections are very good.
Yeah, and I got a book list of other relevant books on Goodreads. We can add that to the show notes as well. Still in the process of reading many of them, but a good selection to go by. And so the message, maybe bottom line here, is that people underestimated this systemically, in terms of the cognitive biases, a systematic error of thinking, systemic or systematic as you will, and they underestimated it. They continue to underestimate it, even if they are no longer laughing. They continue to underestimate it, and it really would be prudent not to underestimate this. This is something that has not happened in any of our lifetimes. There's no listener who has seen anything in his life that would be on the order of this. And it would be very good to get over our normalcy bias. The normalcy bias prevents you from recognizing a potentially lethal situation as a lethal situation. You get held up on the street by a robber, and you try to joke your way out of it. You don't recognize that it's a desperate person who is willing to do whatever he needs to do to get what he wants. And it's really time to get over the normalcy bias, get through the acceptance pipeline, and get your ass in gear.
Yeah.
And in the worst case, you have a little bit of extra supplies at home. It's not such a worst case.
Yeah, you want to err on the side of overreaction and
caution.
Yeah, I think it was also Talib in his paper. I'm not sure where he described that it's basically a different kind of situation. I mean, you're dealing
talking
with
about the fat tail risk.
Yeah, you're dealing with a potentially deadly situation. So it's not about calculating the odds of.
Yeah, exactly. That's maybe one thing we neglected to mention, that it's not like I am planning and prepping. It's not like you are planning and prepping for a single scenario. We are prepping for a range of scenarios.
Yeah.
And we have no way to know which one it will be. But we are more robust against a broad range of scenarios than most people who are right now just beginning to prep and still underestimating the situation.
And it's also not just about us, it's also about other people. If you still have Granny around, it would be good to keep her around. And that depends a lot on your actions, not just on Granny's actions.
Yeah. Over here we prepped and stocked my wife's grandmother, who's already elderly, in close to her 90s. We prepped and stocked her already 3 weeks ago. Granny has a new TV and a lot of food.
That's good.
yeah, she's gonna be okay.
That's good. Well, yeah, man, it's been awesome to have you on. Definitely looking forward to repeat that, hopefully together with Smuggler, and have some sort of future scenario planning and how this all affects the what the states are doing, and also what liberty-minded people can do about this, and the secondary and tertiary effects. As usual, I just gonna close up with the donation report. So, as always, we report the donations in the cryptocurrency we got the most donations in. And last month we got massive donations, and probably people now thought we're so rich. So basically we got very little donations this time. We got 2 milli Bitcoin in Bitcoin and 1.9 milli Bitcoin in Zcash. And that means we kind of like made 20% of the German minimum wage. Smuggler earlier joked that we are ahead of the curve here again, in terms of in the sense that the recession hit us already. But still, of course, we really looking forward to donations, and also are very happy to get any sort of feedback. You can write us at bitstream@taz0.org. You can also find our contact details at taz0.org/bitstream. You can send us also mail. We got some nice donation from the UK. Somebody sent us 6 anonymous SIM cards. That was really handy. And you can also find Arto. He's on his website ar.to. Best
That's
website name ever.
Yeah, I agree.
Yeah, I'm really jealous about that domain.
Hey, there's only one.
There's only one, yeah. And on Twitter, he's @Bendikin. And we're also going to put it on the show notes. And like I said, since he will likely come on the show again, if you have some specific questions you want to ask him, you can also send it to us, and then we discuss it with him next time he's on. So with that, I thank you again, Arto, and hope to see you soon.
That hope may be in vain, but
well, like virtually.
Let's talk again soon.
Let's talk
good
soon.
Talking to you, Frank.
All right. Goodbye.
Bye. Good night.